3, 2, 1, start.
Use a wipe to wipe my stethoscope. Can I check your ID? Please enter name and date of birth. My name is Lisa. I'm a nursing student from Central College. Today I'm going to apply head assessment for you. May I have your consent? Do you have any pen? I start from January 3rd. Please state your name again. Okay, where are we? What's the time? Okay, so my patient is alert, awake, and cooperative, and she is oriented to the person, place, and time. And her physical appearance is skin colors is homogeneous and consistent with genetic background, and there's no unusual order. So body structure is upright and head is erect, and she's taking the relaxed position, and muscles and joints are symmetrical, and her nutrition appears appropriate. There's no unusual obvious deformity, physical deformity. Behaviors, her facial expression is benign and relaxed expression is appropriate. Her dress is appropriate, and her personal hygiene is good, and her mood is calm and cooperative, and she can maintain eye contacts. Let's move to the face. Facial structure is symmetrical. There's no lesions and masses or scars on her face, and there's no involuntary movement of her face, and her facial expression is symmetrical. It's appropriate. And next, test the cranial nerve 7 facial nerve. Jenny, can you smile? Can you frown? And can you show your teeth? Lift your eyebrows. And now can you close your eyes? Okay, I apply resistance against my resistance. Keep closing. Okay. Puff out your cheek. Okay. Resist against the resistance. Okay. She can do it symmetrically, and the strength is equilateral, and the cranial nerve 7 facial nerve is intact. Next, eyes. I inspect the eyebrow present, and they are symmetrical equilateral, and the eyelash distribution even, and the eyelids are symmetrical, and there's no ptosis. Can you keep your head and heel down? Okay, so there's no lid lag, and sclera are white, and now I can check the conjunctiva pink, and eyebrows are symmetrical. There's no protrusion, no second. So next I'm going to test the cranial nerve 3 oculomotor. First, cora. So her pupils are round and equal, symmetrical, and then I use the measure size of the pupil. Both sides 3 milliliters. So next is test the reactivity to the lights. First is direct light reflex test. So I shine lights into one eye. So the same size pupil constrict. Then switch to the other side. Okay, the same size pupil constrict. Next, consensual light reflex test. I shine lights into one eye. So the opposite size pupil constrict. Switch to the other side. The opposite size pupil constrict. Next is accommodation test. Johnny, can you look far away here? And now move back and gaze the tip of the pen. So when she looks far away, her pupils dilate, and when she looks the nearby objects, her pupils constrict and convergence. So my findings are her pupils are equal, around equal, reactive to the light with accommodation. Cranial nerve 3 oculomotor nerve is intact. Next, move to the ears. Inspect the external ear size and shape symmetrical. They are within normal size 4 to 10 centimeters. No macrotia or macrotia. And the skin color is consistent to the facial skin color. The nose is in the middle line and symmetrical, and there's no crusting and no discharge. Let's move to the mouth and the pharynx mouth. The lips, there's no lesion, and they're symmetrical and pink and well hydrated. And pharynx, I'm going to test the cranial nerve 9 and 10, and the tongue letter. I'm going to depress the tongue. So I can see the uvula and soft palate rise in the middle line, and the tonsillar pillows move immediately. And the cranial nerve 9, glossopharyngeal nerve is intact. Cranial nerve 10, vagus nerve is intact. Next, I'm going to test cranial nerve 12, hypoglossal nerve. Can you stick out your tongue, move side to side? Okay. Can you do it while saying light, tight, dynamic? Okay, she can do it with ease and without the tremor. Cranial nerve 12, hypoglossal nerve is intact. Next, move to neck. Inspect and palpate. The neck head is in the middle line and erect. The neck is symmetrical. There's on skin. There's no lesions, scars, no masses. And when I palpate. Okay. So trachea in the position is in the middle line, and there's the thyroid glands, no obvious enlargement, and I palpate the carotid position. 1, 2, 3, one side. 1, 2, 3. So they present the carotid position present bilateral, symmetrical. Oh, did you feel any pain? Okay, there's no tenderness. Okay. Next, I'm going to test the cranial nerve 11, spinal accessory nerve. Can you rotate your head to the side? Okay, this side. Okay, next, can you do it again? Against my resistance. Can you shrug your shoulder? Do it again. Okay, so my patient can do it bilaterally and symmetrical. The strength is equal bilaterally, symmetrical. So cranial nerve 11, spinal accessory is intact. So next I move to the posterior thorax. First I inspect. So the posterior thorax is symmetrical, and the spinal process in the straight line, and rib angles within 45 degrees, and there's no lesions and there's no masses. Okay, so next I'm going to palpate the posterior thorax. Okay, do you feel any pain? Okay, there's no tenderness, no. So the thorax is dry and warm. And next I put my thumbs at T9 and T10 and pinch a little bit muscle between my thumbs. Can I take a deep breath? So my muscles move symmetrically, so the expansion of the posterior thorax is symmetrical. Next I auscultate the thorax. So I use my diaphragm. There's 9 landmarks from C7 to T10, and when I listen, can you take your breath through your mouth, and I will listen to the full respiration. So start from here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So my findings are I can hear bronchial sound, high-pitched sound over thorax and trachea, and the next is a bronchial vesicular sound. It's a moderate sound. It's between the sculpture and it's over major bronchi. And next is a vesicular sound, the lower pitch sound over the lung, peripheral lung area. And so there's no adventitious sounds like wheats and crackers or fraction verbs. Okay, next I move to the apical heart rate in lung. So auscultate apical heart rate, it's at it's mitral valve area, and it's the fifth interspace and the left middle clavicular line, and it's here. So I count with my watch 30 seconds, and multiply 2. Its rate is 72 beats per minute, and it's regular rhythm, and I can hear S1 loop, S2 duck sounds, and no S3, S4 sounds, no mumps. Next, move to the abdomen, lying down. My patient takes the supine position and with knees slightly bent and cover curve for privacy. First, I inspect the abdomen. Abdomen is slightly flat, slightly round and symmetrical, and umbilicals in the midline inverted, and skin is smooth and even. There's no lesions, no scar, no position. Next, I'm going to palpate the 4 quadrants start from right lower quadrant clockwise. So in all 4 quadrants, I can hear the vowel sound, high it's about 16 times a minute, high-pitched gargling cascading sound. Okay, next I'm going to palpate the whole quadrant. Start from the right lower quadrant. Use my 4 fingers together and press down 1 centimeters. The rotation, rotary motion gently. Do you feel any pain? No. Do you feel any pain? Okay. So I lift my finger, move to the other rotation clockwise. Okay. Do you feel any pain? Do you feel any pain? Okay. There's no tenderness, no pulsation, no muscles, so no muscle gargling and rigidity.